Good morning. We're here with Dr. Abby Bleistein of Healthful Life MD, and I wanted to give her a moment to introduce herself and tell us a little bit more about Healthful Life and what they do.
Absolutely. Thank you, Valerie. Healthful Life MD is a medical weight loss program that works with busy professionals who have tried to lose weight in any number of ways, whether it's Weight Watchers or Nutrisystem or other kinds of programs, and have really struggled to either lose weight or keep weight off with those programs. We have a multidisciplinary team. So myself as a physician, I work for the medical aspect, but I also have a certified nutritionist, a dietitian. We have a therapeutic trainer to help with fitness and exercise. I actually have a chef who specializes in culinary nutrition to help people learn to cook meals that are appealing for them and healthy as well, and several different health psychologists. So we really approach the issue of weight loss and sustainable lifestyle change from all aspects to help people and to partner with people to help them be successful.
Well, thank you for telling us more. I was wondering how long you've been in business and what prompted you to open Healthful Life.
Yeah, I'm a physician and I'm board certified in internal medicine and pediatrics and also in obesity medicine. So I specialize in this area. And I had actually been practicing in primary care for more than 14 years when I became certified in obesity medicine. And what I recognized is that, you know, carrying extra weight really impacts health in so many different ways, and that if I could help people in that area, I could really help to get them off medications and really live their best life. And so that's kind of what stimulated me to go in that direction. And I opened the practice to really try and discover, there's lots of different ways to lose weight. But it's really difficult to maintain the weight that we lose, and nobody has the magic answer to that. And so I designed the practice to really give the best effort and to really optimize people's chance of not just losing weight, but losing it in a way that's going to keep them healthy and that's sustainable long term. And so that's why we have the multidisciplinary approach and the team approach. So we can really help people with that sustainable lifestyle change that's going to last and they'll just live their best life.
Great. My next question is a little personal because I turned 40 this year, and you start seeing these headlines, when you turn 40, this might happen to your ability to gain muscle or that you lose muscle, any various things for that age. And I was wondering, as a doctor, if you could give only one piece of advice to women over 40 about their health, what would it be?
Yeah. So, maintaining a healthy weight would actually confer the greatest benefit for women over 40 and for their health. And the reason is that women who carry extra weight as they age are at greater risk of common diseases, including cardiovascular disease, which is the leading cause of death in women and men. We don't always think of it in terms of women, but actually it is. Diabetes, and actually some forms of cancer as well. So, if we think about this and we think about the diseases that are impacted by obesity and even carrying extra weight, women who carry extra weight as they age actually are 3.5 times greater risk of cardiovascular disease. They account for 25 to 30% of breast cancer and colon cancer in women, and those are the two most common kinds of cancer. And it's associated with cancer risk of, and other kinds of cancer as well. Excess weight is the single most important determinant of getting type 2 diabetes, which is really worrisome. That also increases cardiovascular risk, but other kinds of problems like kidney failure, vision issues, other kinds of problems. And blood pressure actually increases in proportion to extra weight as well. So you're at risk for hypertension. What's really interesting, though, is excess weight is associated with medical problems that we don't always think of as being associated with excess weight. For example, abdominal obesity, or if we carry weight in our middle, right? And for women, that's actually a waistline of greater than 35 inches.
Okay.
It increases the risk 2.5 times for Alzheimer's.
Wow.
Which is really kind of, that's significant. And people who carry extra weight are also at greater risk of asthma. So, depending on how how much extra weight they carry, the risk of asthma is actually proportionally increased as well. And so we don't always associate those kinds of problems with extra weight, but it does lead to other kinds of health problems as well.
Well, thank you and you mentioned when women are carrying weight around their middle, and that's when we become apple shaped, right? Is that kind of
Yeah.
the
Yes, that would be.
terminology? The apple
Uh-huh.
shape. And, with the asthma that you mentioned, it makes it really hard to do all kinds of daily activities, especially all the things that we have access to in Colorado. It looks like you're
Mhm.
in the mountains right now, maybe.
Uh-huh.
So things
Yeah.
like that, like hiking as well. But well, thank you
Yeah.
so much, Dr. Abby, for those points about women and turning 40. It's really important to make sure that we pay attention to our health, because it really should be our first priority. Because if we can take care of ourselves, then we can take care of other things in our life. So thank you very much for joining me today.
Absolutely. It's great to see you. Thank you. Take
Take
care.
care.